How you doing? My name is Felix Marquez with Orlando Medical Institute. I'm here to talk about Levophed. I'm going to talk exactly how to administer Levophed, a quick way to determine how many drops per minute to deliver Levophed without doing any math. So I kind of took the math out of this medication drip. But I want to first start with a little bit about Levophed in itself and why we switched to Levophed versus dopamine. Dr. Yana Walker, my medical director, asked me if I can put this video together. We all know in history for many, many years, a patient in cardiogenic shock, we gave dopamine. Just what is cardiogenic shock? Well, the heart has failed to pump. The left ventricle is completely kaput, is the easy way to put it. It's not functionable. So we give a drug that's going to increase the contractility. So we call that a inotropic drug. For many years, we defaulted to dopamine as that inotropic drug. What we found out in recent studies is that patients in cardiogenic shock who receive dopamine end up with lethal dysrhythmias. And as we all know, that could be detrimental to the patient. So what we found out by giving Levophed, these patients had no lethal dysrhythmia. So it's kind of a little favored. We're kind of in favor of Levophed over dopamine now. So you'll see that. Well, Levophed, what is it? It's norepinephrine is what it is. So we know if you talk about epinephrine is a beta alpha drug, but we know it's predominantly a beta drug. So Levophed is its counterpart. It has alpha beta properties, but is mainly alpha. So as epi is mainly beta, which increases heart rate, Levophed is more alpha, which causes vasoconstriction. And that's what we're really looking for in that patient in cardiogenic. So I have Levophed right here, so you guys can see. I want to show you how it comes packaged. Levophed comes packaged 4 milligrams and 4 ml. So it's a 1-to-1. So what we're going to do is take these 4 milligrams and put it into a 250 bag. So just drop the whole bottle. Easy way to remember, the whole bottle is what we're going to put inside a 250 bag. So I have my Levophed. I have my 250 bag. I have my 60 drip set, which we want to use. Anytime we drip medication, especially a medication that's very strong, we want to pay close attention to how we deliver. So the best delivery method, the best vehicle through to the patient is a 60 drops per ml administration set. So as you can see, I already set up the IV bag. So I got my main line. My main line is set up with normal saline. I have my administration set in my bag. I have my 5cc syringe. Why? I'm drawing up 4 ml. So I want to use a 5cc. If you don't have a 5cc, you could use a 10cc syringe. So what I'm going to do is open this up. I'm going to go ahead, obviously always check my expiration date, make sure it is Levophed, and always confirm my dose on hand, which is 4 milligrams per 4 mLs. So I popped the top. If this was open and I didn't pop it, I would definitely clean it first with alcohol prep to make sure we don't introduce no bacteria or anything that could be detrimental to the patient. So take the top off, pull the plunger back because I'm drawing out 4 mLs. I'm going to put 4 mLs of air into it so it makes it easy to draw out. So I'll push the air in, and now I draw out my 4 mLs, as you can see, of Levo. Okay, I have my Levophed. I just want to make sure I take out my air, all right, by just tapping it. Air comes out, and then we'll just go ahead and make sure we get it all out. Very good. Now what I have here, as you can see, is I have 4 mLs of norepinephrine. Okay. Now I'm going to go ahead and spike my bag, open my bag, which I probably should have done first. So take my bag out. I'm going to go ahead, because if it's in a sterile bag, I don't worry about cleansing this. If for some reason this bag was open, make sure you cleanse your port prior to administration. So we go ahead, we put it in. I'm now administering my norepinephrine. Okay. My needle is secure on that syringe. Now what I want to do is label this bag. I want everybody to know that this is a 250 bag with 4 milligrams of Levophed. So I'm going to put Levophed, my concentration, which is 4 milligrams in a 250 bag. Okay. Shake it up, make sure it's good to go, check the expiration date. Now I'm going to show you a nice and professional and easy way to spike your bag. So open up your administration set. Open up your administration set. what I like to do is actually move my drip controller all the way up to where my drip chamber is. So as you can see, it's nice and close to my drip chamber, and shut it down. Lock it completely down. As you can see, the wheel is completely locked down. I now take this, take the top off, take the top off here as well, and then the spike, I place it into the bag. Nice and easy. It's now in. As you see, as I take the bag upside down, nothing is filling my drip chamber because I have this locked down. So what I'm going to do is just pinch this one time and make sure my chamber is filled up halfway with no bubbles. By doing that, I now control how much air goes through my tubing. So I'm going to hang this right here on this IV pole that I have. And as you can see, as it starts to flow, because this is locked down, there will be no air inside my chamber. And I open this up and I control how fast it comes down. And as you can see, I don't know if you can see that little bubble right there. It's filling. And you can see there is zero air in my line. And when it gets to the top, I shut down my drip chamber, and I have spilled zero fluid onto the patient's carpet or onto the table or stretcher where we have our patient. I would take our cap off. By the way, on these drip chambers, you have this little latch right here. And for some reason, I have to stop to do something. That's what that's for, so I don't contaminate my site. All right, so I have my IV, and all you gotta do is just pull this off and then piggyback it right to my main line. That's what I'm looking to do, piggyback. So now I have my Levo and my normal saline. I now want to shut down my main line, and now I could run my Levophed.
Whatever you want.
Okay, so as you see, let's talk about how to set the drips. So we give the proper dose of medication to this cardiogenic shock patient. Dr. Walker has created an awesome drip chart for norepinephrine, okay? Once again, which is Levophed, it tells you the actual how much to mix, which we talked about, 4 milligrams of norepinephrine to a 250 bag of normal saline. All right, now it's 4 milligrams, but what we're giving it is in micrograms. All right, so if we take the 4 milligrams and convert that to micrograms, that's going to be 4,000 micrograms in the 250. If you divide that into the 250 bag, it actually gives you 16 mics for every ml that comes out of that bag. So it's a 16-to-1 ratio. It's good to know. Don't beat yourself up too much about that. Say, man, what the hell Felix is talking about? That just means we're putting 400 micrograms in a 250 bag, and every ml that comes out of that bag, you're giving that patient 16 micrograms, okay? But she came up with an awesome chart, as you can see. So if you're giving it at 1 mic per minute, that's 4 drops a minute. If you're giving it at 2 mics a minute, it's 8 drops per minute. So she's telling you, this is the order. So the mics per minute is the order that they want you to give it. The second column is how many drops you're going to pull out of this drip chamber per minute to meet that mics per minute. So example, if your order is to start and give at 1 mics per minute, then you're going to do 4 drops per minute. Okay, so that's how that works. So that'll be 1 drop every 15 seconds. So you're going to count that, make sure every drop 15 seconds, the second drop should drop out. Another 15 seconds, the third. Another 15 seconds, the fourth. And if you do that, you're giving this patient 1 mic per minute. Just keep in mind, this goes all the way up to 30 mics per minute. With patients in cardiogenic with norepinephrine, we're going to give anywhere from 1 to 16 mics per minute. All right, so let me say that again. In cardiogenic shock, you're going to give anywhere from 1 to 16 mics per minute. Now, guys, real simple, real easy. This is kind of like dopamine, which is we got to figure out a start point where we want to start with this this norepinephrine for this patient. Once we start, let's say we decided to start at 1 mic per minute. Once we start that, what are we trying to do? We're trying to increase cardiac perfusion. We want to bring blood pressure back up. So we want to now assess the patient's vital signs. Do we have improvement? Is the patient's blood pressure, has it come up? If it's come up, then we achieved our goals. Now, if it hasn't, that blood pressure is still low, now I want to start titrating that to the effects of raising the blood pressure. So now I increase my drops a little bit. Once I increase my drops, I go back and reassess my patient to see where's my blood pressure now. How's my patient's condition? Is it improving? Are these signs and symptoms kind of subsiding? So those are things that we need to do. So we're going to keep giving the drug until we achieve our goals, but make sure we don't exceed 16 mics per minute. Okay? So what I'm going to do is go over to this board right here, and I'm going to break down the math because I kind of figured out a way to take the math, the calculation out of the math equations. So remember, we get to give anywhere from 1 to 16. So what I'm going to do is this is going to be exactly the mics per minute. So what I want to start with is actually odd numbers. Odd numbers, okay? So we're going to start with 1 mic per minute. The next odd number is 3 mics per minute. The next odd number is 5 mics per minute. 7 mics per minute. 9 mics per minute. 11 mics per minute. And then we'll go to 13 mics per minute, 15 mics per minute, okay? So I'm writing in this brown color so you can know brown is going to be the odd numbers. So what we know is at 1 mics per minute is always going to be 4 drops a minute. So this equals 4 drops per minute. So this is where I took the math out. If you stay with the odd numbers, we're going to use what I like to call, or what I came up with, is the 7/8 method. So I go to the next odd number, right? So from 1, the next odd number is 3. I'm going to start with 7. I go up 7 more drops. So what's 7 plus 4? Because we're just adding 7 to the 4 drops will give me 11. So 7/8 method. I go to the next odd number. I'm going to add 8 drops to 11. All right, so what's that going to be? So 8 plus 11, 19 drops. And we're just going back and forth. So going from 5 to the next odd number is we add 7. 7 add 7 to 19. That will be 26 drops per minute. What's the next number we're going to add? 8. We're just going back and forth. Then from 9 to 11, 7. All right, so if I add 8 to 6 will be, right, 8 plus 6 will be 34 drops per minute. Now I add 7 to 34, right? So we keep going back and forth. We're just going to add. So 7, 8, 7, 8, 7, 8 is what we're doing, but we're going up in odd numbers. If odd numbers doesn't work for you, then go up in even numbers. So if we go up in even numbers, let's do the even numbers now. So what's the even numbers? 2 mics per minute. 4 mics per minute. 6 mics per minute. 8 mics per minute. And then 10 mics per minute. 12 mics per minute. Same concept, 7/8 method. So to go from here to here, we're going to add 7. So 4, if we're doing 2, we're just going to, because we started at 1 mics per minute. We go to 2, you just doubled it, right? So double this. So what's our start with the even numbers? 8 drops per minute. Now I add 7 to 8. 7 plus 8, 15 drops per minute. What's the next number? From going to 4, next even number, we're going to add 8. So 7, 8, 7, 8. Still same method. So 15 plus 8, right? It's going to be 23. What's the next? So going to the next even number, which is 8, we're going to add 7. So 7 plus 23, 30 drops per minute. Then we go to the next even number. So we did 7, we go 8. So go from 30, now we go from the next even. So we go from 8 to 10. We're now going to take 30 plus 8 is 38 drops per minute. And then you keep going. If I go to the next, well, we're going to add 7 more drops. So it kind of took the math out of trying to figure out how many drops. So in a nutshell, this is a drug that we titrate to the effect. So if I decide to start at 1, I'm gonna just go up in odd numbers. If I decide to start at 2, I'm gonna go up in even numbers. But whatever you decide to go up in, you're gonna use 7, 8. So we have a start point, odd numbers. What's our start point? 4 drops per minute. If I want to titrate that to the effects because my pressure hasn't gone up, I'm going to go to 3 mics per minute. So I'm going to add 7 to the 4. So now I'm going to titrate it and speed up my drops to 11 drops per minute. If I haven't achieved my goals yet, or trying to bring that, haven't got that blood pressure back up, then I'm going to go to the next. I'm going to go up at 5. So I'm going to add 8 to 11, 19 drops. Or if I decided I want to do even numbers, then my start point will be at 2, will be 8 drops per minute. And then I add 7 if I want to go to the next even number. Want to go to the next even number, now add 8, and so on and so forth. So this kind of takes the math out of it. If you have any questions, feel free to drop me an email at fmarquez, marquez, @omi.edu. I hope this was informative. I hope this helps you out with being more aggressive to use the Levophed. I can't tell you, I can't tell you enough. I can't emphasize enough how good of a drug this is for those patients who are cardiogenic. If we do nothing for a patient who's in cardiogenic, we really take the chance of losing this patient, or this patient has a poor prognosis down the line. So I hope this video helped out. If you have any other questions, like I said, feel free to drop me an email or call your medical director, Ayana Walker. I'm sure she'll be eager to answer any questions. Thank you.